Bismillahirrahmanirrahim. The quote of today is by Jalaluddin Muhammad Rumi, who says, "The sum of my whole life is no more than these three sayings. I was raw, I got cooked, I got burned." Hello everyone, I am Dr. Muhammad Awais, and today I am going to present studies design, the cohort studies, under the kind supervision Professor Dr. Saira Afzal. The learning outlines of today's presentation is what is cohort study, design of a cohort study, prospective and retrospective cohort study, advantages and disadvantages, and at the end are the recent advances and MCQs. By the end of this presentation, participants will be able to describe what is cohort study, how it is conducted, how the relative voice and odd ratios can be calculated and interpreted, how to differentiate between prospective and retrospective cohort study. Cohort study is a type of analytical observational epidemiological study. Cohort studies are type of observation studies in which a cohort or group of individuals sharing some characteristic are followed up over time to evaluate the occurrence of outcome of interest. It is a longitudinal prospective study and it is an incidence study from which incidence can be defined. It starts with people free of disease and assess exposure at baseline, assess disease status at the follow-up. Now what is cohort? Cohort is a group of Cohort is defined as a group of persons usually 100 or more in size who share a common characteristics. For example, a group of pregnant women or children under the age of 5 years and men, those who are suffering from HIV. Now the indication for conducting a cohort study. Cohort study is conducted when there is a good evidence of exposure and disease, and when the exposure is low or the incidence of disease among exposed is high, when follow-up is easy and cohort is stable, and when ample funds are available. Now the design of a cohort study. The cohort study is started when the investigator lets the population of interest and then further divide this population into exposed and unexposed group based to the risk factors, and then follow up over time to find out who develop the outcomes and those who don't develop the outcomes in both the exposed and unexposed group. It moves in forward direction from exposure to outcome. The investigator starts by first selecting the exposed and non-exposed group, then follow to see whether they develop disease or not. And from this, the incidence rates of disease can be calculated by simply dividing those persons who develop the disease by dividing those number of individuals who are exposed to the risk factor. Let us take an example of a familiar example of cigarette smoking and the development of coronary heart disease. The investigator will first divide the population based on the exposure to the risk factor, for example, the cigarette smoking, and those who do not smoke cigarettes, and then follow up to see whether they develop coronary heart disease or not. Then the incidence calculated is by dividing those persons who develop the coronary heart disease by the total number of persons who smoke cigarettes. And similarly, the incidence per thousand per year can be calculated by those who don't smoke cigarettes. And I am going to discuss here briefly the relative risk and odds ratio. The relative risk or risk ratio is the ratio of probability of an outcome in an exposed group to the probability of an outcome in an exposed group, while the odds ratio is a measure of association between exposure and outcome. The odds ratio represents the odds that an outcome will occur given a particular exposure compared to the odds of outcome occurring in the absence of that exposure. And these are the formulas for calculating both the relative risk and odds ratio. In cohort studies, both the relative risk and odds ratio can be calculated. For the previous example, the relative risk calculated is 1.60 and the odds ratio calculated is 1.62. And how we interpret these values: if relative risk is equal to 1, the exposed and unexposed groups are equally likely to get the disease. And if relative risk is less than 1, the exposed group is less likely to get the disease than the unexposed group. And if the relative risk is greater than 1, the exposed group is more likely to get the disease than the unexposed group. And how we interpret the odds ratio: the further away an odds ratio is from 1, the more likely it is that the relationship between the exposure and the disease is causal. Now the comparison of the cohort studies within the randomized control trial. both the study designs are similar in that we are comparing the exposed and unexposed groups, but in experimental study uh, we give an intervention and we do randomization, while in observation studies we don't give any intervention. uh, don't give an intervention because these are conducted mainly for the harmful risk factors, for example smoking, alcohol, or exposure to radiation, so we cannot allow the subjects to have these harmful risk factors. Know the selection of a study population. This can be started uh, by two methods. The researcher can start either by selecting the exposed and not exposed group, then follow up over time to see whether the disease developed in the exposed or not exposed group, or the researcher can start his study by selecting a defined population. He doesn't know the exposed and non-exposed group, and then follow for time. He take histories from the defined population, or take the result, take the laboratory investigations or some other thing to find out who are exposed to certain risk factors or not exposed, and then follow up over time to see the development of disease or not. But the comparison in both of these selection of study population, comparison is the hallmark of cohort study. There are two types of cohort studies: prospective cohort study and the retrospective cohort study. Now, what is a prospective cohort study? A prospective cohort study starts when the investigator selects a population and they screen for healthy people and find out who are exposed to certain risk factors or not, and then follow up over time to see or find out whether the outcome of interest has developed in exposed or unexposed group. It moves in forward direction. None of the exposure or the outcome has occurred before the investigation, and before the investigation has investigator has started his study. Both occurred after the study has begun. It moves in forward direction from present to future. Let us take an example, familiar example of the cohort study, that is the Framingham study that begins in 1948. The population of Framingham is 30,000, and it would be appropriate and would facilitate follow-up. The residents were considered eligible whose age is between 30 to 62 years of age, because it was assumed that above the age of 62 years, the coronary heart disease had developed, and before 30 years, there are less chances of having the risk factors for the coronary heart disease. So the total sample size selected in the Framingham heart study is 5127. Uh, those individuals who in the age range of 30 to 62 years, and they are free of coronary heart disease. Exposures are defined as including smoking, obesity, elevated blood pressure, elevated cholesterol level, low levels of physical activity, and other factors. New coronary events or the outcomes were identified by examining the study population every 2 years and by daily surveillance of the hospitalizations at the only hospital in the Framingham. Now the prospective or historical cohort studies. The difference from the prospective cohort study is that the investigator starts his study when the outcome and exposure both has occurred, and the investigator goes into the past, selects the population and divide them into the exposed and non-exposed group based on to the risk factors, and then check the records and various registers to find out whether the outcome of interest has developed or not in the exposed and unexposed group. The basic difference is that both the outcome and exposure has occurred before the investigation has been started. Example of a retrospective cohort study is that Short et al. Performed a retrospective study to examine the effect of beta blockers in the management of COPD. They searched a disease-specific database of patients with COPD and linked to the Scottish morbidity records of acute hospital admissions, the Tayside Community Pharmacy, the prescription records, and the General Register Office for the Scotland Death Registry. A total of 5,977 patients of ages greater than 50 years with a diagnosis of COPD were identified and divided into two groups according to the beta blocker use or not. The study found that beta blockers might reduce mortality and COPD exacerbations when added to the established inhaled stepwise therapy for COPD. and with no adverse effects on the pulmonary function. So what is done in the retrospective study? That the patient have taken the beta blockers and the outcome of interest, that is the COPD, has occurred before the study has been conducted. So they go into the past, they check the registers and various records, and then find out whether the beta blocker users and not users the outcome of interest, that is the uh, exacerbation of COPD and other effects. So the difference between the prospective and the retrospective cohort study. Retrospective means looking backwards into the past, while the prospective means looking forward into the future. A retrospective study is a type of cohort study that analyzes two groups of people, those with disease under study as well as a very similar group of people who do not have a disease. While the prospective study is a type of cohort study where the researcher enroll participants into the study before they develop the disease or the outcome in question. Retrospective study involves a group of people who already have the disease under study, while the prospective involves a group of people who don't have the disease under study. Now, let us discuss another difference between the retrospective cohort study and the case control study, because both are the retrospective studies. In case control study, the researcher starts his study by selecting the groups that have in which the outcome have occurred. They uh, they selected the groups based on the cases and controls. Cases are those in which the outcome of interest has occurred. Then they look into the past to compare the risk factors, the exposure to the risk factors. So the direction of the study from present to the past, it starts with the study of the outcome. While in the retrospective study, the investigator starts his study by dividing the population into two groups uh, based on their exposure to the some risk factor or not risk factor. Uh, for then he compares both these groups to find out the outcome. The direction is study is from past to present. Start with the study of exposure. It moves from cause to effect. That is the basic principle of the cohort study, and it moves from effect to cause or the outcome to exposure. That is the basic principle of the case control study. Know the potential biases in the cohort studies. There are many kinds of biases that can arise in cohort studies. Two are discussed here, the selection biases and the information biases. The selection biases are the non-participation and the non-response, because the cohort studies are long studies. They may last for 1 to 2 decades. So there is a chance of non-participation and non-response of the participants in the study are lost to the follow-up. So the selection bias may arise. Are the information biases? The quality and extent of information obtained is different for exposed person than for non-exposed person, especially in the retrospective cohort studies. Because they travel into the past, uh, uh, there may be a recall bias. The pre-existing knowledge of the researcher about the disease to be developed and its outcomes, and the strong preconception of the researchers. So the effect of the confounding. Confounding often occurs in cohort studies. For a variable to be confounded, it should meet three conditions. It should be associated with the exposure being investigated, be associated with the outcome being investigated, and not be in the causal pathway between the exposure and the outcome. Confounding could result in a distortion of the effects. It may lead to the overestimation or underestimation effect, or even reverse the direction of an effect. I put here an example in which the researcher wants to find the association of alcohol consumption risk factor with the outcome of lung cancer. Here the confounder is smoking. It is assumed, it is known that alcohol consumers also smoke cigarettes. So it can confound the result because there is a strong association between the cigarette smoking and lung cancer. So uh, to find the result to be significant, we have to remove the confounding effect of smoking to find the association of the alcohol consumption and lung cancer. Know the strengths and the weaknesses of the core study. The advantage is that it can investigate multiple outcomes that may be associated with multiple exposures. and it is able to study the change in exposure and outcome over time. It is good for examining where exposures and can measure incidence of outcome may be able to infer causality. While the prospective study is able to control design, sampling, data collection, and follow-up methods and can measure all variables of control, while the retrospective study is time efficient and inexpensive and easy to obtain large samples. While the disadvantages are that it is susceptible to loss of follow-up compared with the cross-section studies, confounding variables are the major problem in analyzing the data compared with randomized control trials. While prospective study is may be expensive to conduct and it is time consuming, while the retrospective studies are less control over variables and is susceptible to information bias or the recall bias. So time for recent updates. The first article's title is Poor Discharge Outcome of COVID-19 Cases Reported from Pakistan. This is a study that was published in 2021. The aim of study is to characterize the clinical outcomes of COVID-19 patients following discharge from hospital study. The design of the study is prospective cohort study. Place and duration study is the Department of Infectious Diseases Liaquat National Hospital Karachi from 1st May to 31st August 2020. The methodology is like that 96 patients were included ages over 23 years and had a confirmed COVID-19 on PCR. At the time of admission and on discharge, in hospital data were recorded. The demographic information, symptoms, complete blood count, inflammatory marker, and chest X-rays were noted. Result. Diabetes 50% and ischemic heart disease 50% were the most frequent comorbidities. The majority of patients, 70.5%, improved their exit findings after being discharged from the hospital. At the time of discharge, 75% of the patients expressed fatigue. None of the patients developed a fever. There was a substantial significant difference in tiredness for discharge and in the fourth week. Significant variations in shortness of breath and oxygen consumption were also found between tiredness indicated at the discharge and at the fourth week. The majority of lab values were within normal limits. The conclusion is that most people gradually improve after receiving appropriate treatment and supportive care in the hospital and later at home. The most prevalent and prolonged symptom reported by most patients was fatigue. By the fourth week, most symptoms have had ameliorated significantly. The second article's title is Risk Factors with the Dengue Fever Outbreak in Islamabad, Pakistan, a Case Control Study. The background is that on October 23rd, 2016, 79 dengue fever cases were reported from Union Council that is located in Islamabad. A team was established to investigate the suspected dengue outbreak. The objective is to find the aim of the study was to determine the extent of outbreak and identify the possible risk factors. The methodology is the active case finding was performed through a house-to-house survey. A case was defined as acute onset of fever greater than 38 degrees centigrade in a resident of Tarlai from October 2nd to November 11, 2016 with the positive dengue virus, that is the known structure protein NS1 test, and any of the two of the following signs and symptoms as a retroorbital or ocular pain, headache, rash, myalgia, arthralgia, and hemorrhagic manifestation. A structure question was used to collect data. Age and sex match controls 1:1 for identified from resident in the same area as cases. Blood samples were taken and sent to the National Institute of Health for genotype identification. During the active case reserve, 145 cases of dengue fever were identified by surveying 928 houses from October 23rd to November 11. The attack rate was 17 by 10,000. The mean age was 34.44. More than half the cases were male. Among all the cases, 29% belong to 25 to 35 years of age. All 5 blood samples tested positive for NS1. The most frequent presenting signs symptoms were fever and headache, 100%. Stagnant water around houses, odor ratio was 4.86. Presence of flower pots in the home, odor ratio is 2.73, and open water containers odor ratio is 2.24. Showed higher odor ratio among cases. Conversely, use of bed nets odor ratio 0.44, insecticidal spray odor ratio 0.03. Door screens odor ratio 0.27, mosquito coil or mats odor ratio 0.26, and cleanliness of hose odds ratio 0.12 showed significant positive protective effects. The conclusion is that stagnant water acting as breeding ground for vector were identified as the probable cause of spread of dengue outbreak. Establishment of surveillance and an early reporting system along with use of protective measures against the vector are strongly recommended. Now the time for MCQs. First MCQ is a group of students in King Edward Medical University are going to conduct a cohort study to find out the health outcome of consuming large amounts of fast food. Cohort studies generally look at which of the following, whether to determine the sensitivity and specificity of diagnostic method, identifying patient characteristics or risk factors associated with the disease or outcome, variations among the clinical manifestation of patients with the disease, the impact of blinding or masking of study population, or the inclusion of only one group in study. Which is the correct option?
B.
Yes, B. Bravo is the correct option. It deals with identifying patient characteristics or risk factors associated with the disease or outcome. Second MCQ is a study began in 2010 with a group of 600 adults in Lahore who were asked about their alcohol consumption. Then occurrence of liver cirrhosis was studied in this group in 2022. This is an example of whether the case control study, prospective cohort study, retrospective cohort study, analytical cross-section study, or randomized control trial.
B. C. B. B. B.
B. Yes,
Beta.
this is an example of prospective cohort study because it moves uh, from past to present. The researcher begins his study in 2010. The exposure is alcohol consumption and the followed up over time, and the outcome is measured in 2022. So it is a prospective cohort study. Third MCQ is, in a cohort study, the relative risk for developing diabetes was 0.86. When compared consumers of tea, the exposed group, to those who did not drink, the unexposed group, which one is the correct statement? The tea drinkers have low risk of developing diabetes. The tea drinkers have higher risk of developing diabetes. Based on information given, we cannot tell if the observed difference in the disease risk is the result of chance. The risk ratio is close to the value 1, so there is no difference in the disease risk between the two groups, or the odds ratio should also be given to interpret the results.
Charlie.
B.
C.
The value is less than 0.86. The relative risk value is 0.86. That is, if the value is less than 0.86, that it means that there is no association between the risk factor and the development of the outcome. So in this regard, option A is the correct one. The tea drinkers have low risk for developing the diabetes. Fourth MCQ is, an investigator in 1960 conducted a study to find out the health outcomes of predictions of nuclear attacks in Hiroshima and Nagasaki in 1945. Which of the following is an advantage of a retrospective cohort study? Whether not susceptible to information bias and recall bias, time consuming, may be expensive to conduct, can measure incidence of outcome, it may be used to study etiology of a rare disease.
Alpha.
Yes, alpha is the correct option, while others are not. Retrospective cohort studies are characterized by all of the following except the study groups are exposed and not exposed. Incidence rates may be compared. The required sample size is smaller than that needed for a prospective cohort study. The required sample size is similar to that needed for a prospective cohort study, and they are useful for rare exposure.
Charlie.
Yes, Charlie is the correct option. The sample size is smaller than that needed for the prospective cohort study because the sample size is similar to that for the prospective cohort study. Sixth MCQ is, in 2020, investigators were intended in studying early adult obesity as a risk factor for cancer mortality. The investigator obtained physician health reports on students who attended the University of Punjab between 1958 and 1968. These reports included records of students' heights and weights at the time they attended the university. The students were then followed up through 2020. Mortality information was obtained using death certificates. This study can be described as case control, prospective cohort, retrospective cohort, analytical cross-section, or RCT.
Beta. B.
Some other option?
C.
C, yes, retrospective cohort study. This is a type of retrospective cohort study because the study begins in 2020. The investigator goes into the past to see the exposure of obesity in 1958 and 1968 and then find the outcome, that is the mortality in 2020. So, so the researcher goes into the past and then measures the exposure and the outcome of disease that both have occurred before the study has begun. So it is a retrospective cohort study. Seventh MCQ is an investigator takes a sample of healthy individuals, record their ongoing solar exposure, and relate that to the subsequent occurrence of skin cancer in the same group. Which type of study design is this? Whether case control, prospective cohort, retrospective cohort, analytical cross-section study, or the randomized control trial?
E.
It is a
B.
B. Yes, B is the correct option. Prospective cohort study because this is a the investigator none of because the investigator when starts his study, none of the exposure or the outcome of interest has occurred when the investigator has started his study. So it is a prospective cohort study. It is not a randomized control trial because in randomized control trials the patients are given intervention. This is an observation study. We don't give any intervention, but we only observe for the exposure and the outcomes. Eighth MCQ is in a cohort study, the advantage of starting by selecting a defined population for study before any of its members become exposed rather than starting by selecting exposed and non-exposed group is that the study can be completed more rapidly, a number of outcomes can be studied simultaneously, a number of exposures can be studied simultaneously, the study will cost less to carry out, the study will have no confounder. What is the advantage of
C.
selecting a defined population?
Charlie. Charlie.
It is a bravo. Number of outcomes can be studied simultaneously. This is a characteristic of the cohort study. Ninth MCQ is researchers are conducting a prospective cohort study of the association between an office worker who uses a computer daily and the carpal tunnel syndrome. Association of office computer daily use and the development of carpal tunnel syndrome. Researchers choose a group of office workers from one company to be their exposed group. Which of the following unexposed or less exposed comparison group would be the best choice? Whether a group of high school students who use computers daily, another group of office workers at a different company who do not use computers daily, uh, or another group of office workers at the same company who do not use computers daily, or a group of professional golf players who use their hands or arms intensely for their sport, or a group of home workers who work on computers daily in their home. Which is the correct option in selecting the unexposed group?
Alpha.
In this
Charlie.
in this case, Charlie is the correct option because uh, the comparison group of the unexposed group have shared some common characteristics, but they are not exposed to the but they are not exposed to the risk factor. So in option C, there is a group of office workers of the same company. They are working in the same company, but they are not using the computers. So it is the best uh, comparison group for the unexposed group. Last MCQ is on December 16, 2014, terrorist attack on Army Public School Peshawar, Pakistan, left behind more than 100 children dead. A researcher in 2022 conducted a study on students of APS Peshawar who witnessed the attack to find out the post-traumatic stress disorder in their later life. What type of study design the researcher is using, whether the case control, prospective, retrospective cohort, analytical section, or another randomized control trial?
Charlie.
Yes, it is a retrospective cohort study because both the exposure, that is the effects of the terrorist attack, and the outcome, that is the post-traumatic stress disorder, both has occurred when the investigation has started in his study, and then the investigator go into the past to check the report and then find out the association of the terrorist attack and the development of post-traumatic stress disorder. So this is a retrospective cohort study. Here is the key of my MCQs, and thank you very much.
Thank you very much, Dr. Awais. Very nice presentation, and very beautifully you have covered all the important aspects of study design. One of my observation is if you please go to your last MCQ, uh, MCQ number 10, please. Right. Now this on December 16, 2014, terrorist attack on Army Public School Peshawar, Pakistan left behind more than 100 children dead. A researcher in 2022 conducted a study on students of APS Peshawar who witnessed the attack to find out most post-traumatic stress disorder in their later life. What type of study design the researcher is using? Right. And we have the options of retrospective cohort study, and that has been correctly identified by our students. However, there is another study design that is called ambient cohort study. In ambient cohort study, we have the retrospective cohort study combined with the prospective cohort study, and we go to the future. As this line, as you have said, to find out the post-traumatic stress disorder in their later life, it means that their whole life would be covered. So if a student was of 10 years at the time of the attack, and later on his post-traumatic stress disorder that develops after a certain time and continues till his 40 years of life, it means you have to follow him for 30 more years. And that would go into future. We don't know all the students who are the victim of this. They are getting post-traumatic stress disorder till 2022, as we don't know this, and we are not very much sure that that could happen. And as a scientist, we all know that we can't give a definite date that this post-traumatic stress disorder would develop till this date. So we can't say that the post-traumatic stress disorder, the outcome that would occur in 2022, or all the students who were being followed, they would have it till 2022. It may be in 2023 or 2024 or any day in future. So it should be the ambient cohort study design.
Yes, ma'am.
This is one of very important MCQ, and it has given us the insight not only in the cohort study but also in how the prospective cohort study, retrospective cohort study, both can be combined in a single study design, and that is called ambient cohort study. Another important thing is sometimes we also have the study design where we have the cohort study along with a nested case control study. All those who develop the case control cases, who develop the post-traumatic stress disorder, they were able to give their detailed history. They can be recruited, and they were asked about their past experiences, etc. And that type of the study is called nested case control and cohort study. So another study design can also be used here, that all those who develop the post-traumatic stress disorder, they would be asked about their experiences and about their victimization and attack